Resume with consideration of today's topical issues. The first issue has been submitted in the name of Deputy John Brassil, who wishes to discuss the FEMP announcement and cuts to pharmacist fees. The floor is yours, Deputy Brassil.
Thank you very much, Count Corla, and I greatly welcome the opportunity to raise this issue, Minister, which has every pharmacist in the country up in arms since it first came to light last week. And Minister, I'll cut straight to the chase. Over the last number of years, I have interacted with you, with your department, in this chamber, at committee, privately, publicly, and you have interacted with the IPU, and you have given them very strong indications that you were willing to engage with the sector towards rolling out what's now an underutilised service, getting better value from pharmacists, and negotiating a new contract and commencing the reversal of FEMP in 2020. Now, Minister, the announcement last week that there was going to be a potential 3 further cuts to the payments of pharmacists, and I have to point out that I have an obvious conflict of interest being a pharmacist and a pharmacy owner myself, but I'm here representing the pharmacists of the country today. This flies in the face of every previous discussion we have had, and I have always taken you as being an honourable person and a man of your word. And I simply cannot believe what happened last week. What's being proposed, Minister, will take a minimum of €25,000 from the bottom line of every pharmacy in the country. And that is on foot of cut after cut after cut. There hasn't been an increase in fees for over 10 years. We are working night and day trying to keep our businesses viable, and this is the straw that will break the camel's back. Now, as you know, Minister, pharmacists are a non-antagonistic group. They are non-confrontational, they are cooperative and they are willing, and so are the IPU. But on this occasion, it has gone too far. And Minister, in the reversal of FEMP, you have often said that it needs change practices. And I've just listed, in the last 3 years, 12 different items that pharmacists have done that have saved the system money that we have done without getting 1 cent of extra payment. Non-oral anticoagulants. Hundreds of thousands of patients get those every week in our pharmacies. We do all the admin work around it. When patients come in with prescriptions, when they're not sanctioned, we do all the work. We give them their medication, and in many times we don't even get reimbursed for the first month. We don't get reimbursed till the patient gets sanctioned. If we sent those patients back to the consultants and back to the doctors, there would be chaos. The high-tech hub takes hours every week out of pharmacists' time, sanctioning high-tech medication, critical medication for thousands of patients across the country. And again, Minister, all this work has been taken on by us free of charge. And you're now saying you want to cut the high-tech fee. Really, Minister, it is beyond belief. There's Interesto, Fempara, Furidin, Prolia, and so on. 3 weeks ago, or 3 months ago, or nutritional supplements. A huge cut in what's been allowed. We have been interacting with the patients, with the doctors, with the consultants, letting them know what is reimbursable and dealing with so that the patient goes out the door with their vital medication. Now, Minister, this is not a way to commence a FEMP negotiation. This is not a way to commence negotiations around a new contract. And you have stood in front of the IPU at their annual conference, you have stood in front of me at committee, and you have given me your firm assurance that you want to work with us and you want to roll out a new contract which will bring about a better system, better payments, fairer payments. If this goes, Minister, you cannot allow it to go ahead, and I just say, I don't want to hear that, it's your department. You're the Minister.
Up, Deputy. Thank you.
It's your government, and we have put our faith in you, and I expect you to honour your commitments. Minister. Thank you, Minister.
Thanks very much. I always endeavour to honour my commitments at Count Corla, and I want to thank Deputy John Brassil for raising this important matter. And I genuinely note his keen interest in this, not just as a pharmacist, but his advocacy in relation to the role that pharmacy has to play from a public health policy point of view in relation to the delivery of stauncher care. And I've had very good and sincere engagements with Deputy Brassil during my time in office on this, and I do genuinely acknowledge that and thank him for this on the record of the House. As Minister for Health, I very much value the role that pharmacists play in the Irish Health Service in the delivery of patient care. Community pharmacy is rightly recognised as the most accessible element of our health service, with an unequalled reach in terms of patient contact and patient access. That is why, as the Deputy correctly says, I have given a very clear commitment to commencing a thorough review of the pharmacy contract in 2020. In broad terms, this will address the role to be played by community pharmacy in the context of Sláintecare and in delivering a multidisciplinary model of service delivery for patients, ensuring clarity of roles, avoidance of duplication and achieving optimum value for money. And I recognise already that the IPU have brought forward ideas and proposals and suggestions that they have in that regard in terms of how pharmacy can do even more in terms of shifting services from the acute setting to the community setting, and perhaps ensuring that pharmacists can do more in terms of their scope of practice. A contractual agreement that is fit for purpose in a healthcare system that is increasingly seeking to tilt the balance of care towards a strengthened primary care system is now much required. The vision and approach which underpins Sláintecare needs to be mapped out for community pharmacy. A primary care model integrated with other health policies which will require the expansion of both the scope of practice and the range of public services provided in community pharmacy. I'm thinking particularly of the very successful pilot we had in relation to a minor ailment scheme that could well be an area of expansion. In May of this year, as the Deputy rightly reminds me, though I certainly haven't forgotten, I addressed the Irish Pharmaceutical Union at the National Pharmacy Conference in Galway, and in my keynote speech I made a clear commitment to move beyond the arrangements underpinned by the Financial Emergencies Measures in the Public Interest Act 2009, as I have done for other professions, with a view to optimising the role of pharmacists in the years ahead. I very much stand by that commitment, not to move back to pre-FEMPI arrangements, but to move on to what I said at the time, and I quote, to a higher terrain. I am satisfied that we can agree a new contract next year that will do precisely that. However, in the meantime, I am obliged, under law, before the end of the year, to put in place a new framework to maintain a statutory basis for contractor fees, as the existing regulations will be revoked from the end of this year in accordance with the Public Service Pay and Pensions Act 2017. That's not a new piece of information. It's a statement of fact based on an act that this House passed. Prior to the making of the regulations, I'm also required by law to consult the representative body for pharmacy contractors, the IPU. In that respect, this statutory consultation is now underway, and my officials wrote to the IPU on the 10th of October inviting them to discussions on the making of new regulations. Subsequently, meetings were held in my department at an official level on the 24th of October and the 7th of November, following which a detailed and welcome submission was received from the IPU. That submission is currently being considered by my department, and I also have agreed to a request from the IPU that I would meet them directly in the coming weeks as well. So I do want to assure Deputy Brassil that no decision has been made yet in this regard. He'll, I hope, understand and appreciate that whilst the statutory consultation process is underway, I'm somewhat limited in terms of what I can say. But we have received the detailed submission from the IPU. It has been given the most serious consideration, and I'm very conscious of the fact that we will be entering contract negotiations at the start of 2020, and the sequencing of these issues needs to be considered. I expect to see discussions on a new contract begin early in the new year, because I fully believe that community pharmacy contractors have an important contribution to make in realising my future vision, and indeed I think it's yours also, for community care, which needs to be enabled by a modern, fit-for-purpose contractual relationship with the HSE.
Minister, Deputy Brassil.
Thank you, Minister. Indeed, Minister, I am aware that there is a statutory framework that needs to be put in place, but I'd simply say leave it as it is and commence your new negotiations for your new contract and your new fees under the existing arrangement. The existing arrangement, which I would add, has already taken 33% from payments from pharmacies for the last 10 years. We have carried more than our fair share of the burden over the difficult times. And on top of that, as I've pointed out, the numerous different extra work that we have taken on outside of our contract. And Minister, I'm trying to express to you, in as calm a way as I can, the absolute anger that's out there amongst pharmacists. I would not be surprised if they withdrew their cooperation in the high-tech hub, withdrew their cooperation for NOACs and brought about chaos in the system that's already overburdened. And that is coming from a group of people who have never been antagonistic, they have never been confrontational, and they have always been cooperative and willing. So, Minister, the dentists, I believe, are moving into 2020 with the same framework, the same signing, and no change. You're reversing FEMPI for the GPs, which we welcome. They're not being asked to take further cuts. As a matter of fact, they're beginning to get back payments which they previously had. Please do not treat pharmacists differently. We do not deserve it. We are a very honourable, hard-working group of people that provide a fantastic service to society and to the communities. And the one thing that you will not hear in the health system, Minister, you will not hear of the pharmacy system being in chaos. We do a good job and we do not deserve this. I will take you at your word when you meet the IPU and the negotiations in the coming weeks that what was put on the table last week, the first thing that will happen at that meeting, will be taken off the table. You will sign what we have already and we will renegotiate in 2020 for a new contract and for the reverse of FEMPI. Thank you, Minister.
Thank Deputy Brassil again, Cian Corley, for raising this important matter. I share his view that pharmacists are always honourable and constructive in terms of their engagement with the state. I've referenced in this House before, and I'd like to do again, most particularly and recently, that's related to our Brexit preparedness, an area where there's been huge leadership by Darragh O'Loughlin, particularly as the CEO of the Irish Pharmacy Union, but also by pharmacists up and down the length and breadth of this country, and perhaps it's left us better prepared than other jurisdictions as a result of that constructive engagement and collaboration. I want pharmacists to do more. Pharmacists want to do more. And in order for them to do more, we need to resource them more. I get that. I genuinely get that. That's why I want to start contract negotiations, similar to what we successfully agreed with our GPs, where 95% of GPs voted in favour of the new agreement. The law of the land revokes the existing regulations at the end of this year. The law of the land obliges me to put a new framework in place, and the law of the land obligates me to consult with representative bodies before doing that. That consultation is well underway. Letters have issued, meetings have taken place, a meeting with me will take place, and a very detailed and constructive submission has been received from the IPU and is being actively considered. I am conscious of the fact that we believe that there are efficiencies to be made, and I don't think pharmacists disagree with that. But I'm also conscious of the fact that we're going to be sitting down in a few weeks' time, hopefully, on a new contract. And how those two interact is something I'm giving a lot of careful consideration to, and I want to say that today. So the document submitted by the IPU is being actively considered at the most senior levels within my department and by me. I will be meeting with the IPU and we will decide how best to proceed in due course. I don't feel it would be constructive to go further than that today as that consultation process is ongoing. But I hear very clearly Deputy Brassil's compelling arguments.
Thank you very much, Minister. We move to the second important item. It's a bit